Disclaimer: this is a role play developed as part of the course curriculum for Managed TB and online course for doctors. The participants have enacted the role given to them. The case discussed does not refer to any existing patient but has been developed as part of the course curriculum. The investigations, X-rays, and lab reports used in this case scenario belongs to patients treated in NIRT. Their identity have been anonymized. Good morning, sir.
Good morning, Dr. Vignesh.
So I have a case to discuss with you. Is this an appropriate time, sir?
Yeah, this is the right time we can discuss about that case.
Sir, we have a 50-year-old male who is a doctor with presenting complaints of low back pain for the past 3 months, loss of appetite and loss of weight for the past 3 months, and generalized tiredness for the past 4 months, sir. He is also non-diabetic and hypertensive on treatment.
Okay. Did you collect any additional details of history and do any clinical examination in this patient?
Yes, sir. Detailed history reveals that he has been having this back pain for the past 3 months, which was insidious in onset and gradually progressive, particularly in the lumbar region. There is no pain in the cervical or the thoracic region, sir. He also has low-grade intermittent fever for the past 1 month. His past history reveals that there was no treatment for tuberculosis previously, and he is non-reactive for HIV. Since he is a non-diabetic, he has been on oral hypoglycemic agents for the past 7 years with good glycemic control. On clinical examination of his spine and lower limbs reveals that there is mild tenderness in the lumbar region but with no deformity. His lower limb shows no signs of wasting or any neurological deficits, sir.
Based on the history and the clinical examination findings, what do you think could be a presumptive diagnosis?
So given his age, I would like to first rule out the possibility of a malignancy and also the possibility of a TB spine since he is a non-diabetic, sir.
Okay. So, good. We have to consider TB spine and malignancy in this patient. So, we have to order an MRI of the spine, and you also have to order a chest radiograph to rule out any lung pathology.
Sir, what about an X-ray of the spine, sir? Is it useful in diagnosing a TB case?
Certainly, it would be useful, but the spinal lesions would take 3 to 6 months to appear in the X-ray. So, it is of limited use in detecting the lesion earlier. So, it is where MRI is useful in detecting the lesions in the early stages of the disease, and it will help us in understanding the extent of the lesion, the magnitude of the bony destruction, and the spinal cord involvement.
Okay, sir. Sir, can I confirm and suggest treatment for TB just with the MRI findings?
Yeah, you can suggest treatment based on the MRI findings, but as I already mentioned, we have to be careful in ruling out malignancy before we start him on TB treatment.
Sure, sir.
Okay, so you will start working on this patient?
Definitely, sir, right away.
Okay. Can you summarize the discussions that we had now?
Definitely, sir. MRI is superior to plain X-ray of the spine in the diagnosis of TB spine. We have to rule out malignancy before initiating treatment for TB spine.